Well, hey there, YouTube. So, I am doing a response video to an old friend of mine from high school who is taking some graduate classes in the medical field. So, a little bit of background about myself for my old friend's class. I identify as a lesbian. I have been out, or I mark my coming out day as the day after I graduated from high school. I consider myself to be an LGBT activist, an activist for lesbian, gay, bisexual, transgendered. I was very active when it comes to LGBT rights in college. I did a lot of activism, a lot of activism in support of LGBT rights. And yeah, that's me. So, let's get right into the questions from my old friend from high school. Are you afraid to seek healthcare because you're afraid you will be judged for your sexuality? When I was a little bit younger, I believe I was, but now as an adult, no. Though I will tell you this, if I did have a doctor who was not LGBT friendly, I would promptly request another one. But overall, in my last 8 years as an openly LGBT adult, my experiences with the healthcare community have been relatively positive, both as a patient and as somebody supporting a patient. There's been a handful of awkward moments, but it wasn't negative. At one point I had to have a chest x-ray, and the technician asked, risk of pregnancy. And, well, I promptly replied to this, only if my girlfriend's magical. Which, apparently the technician was a little bit put off by that, but, you know, I said it jokingly, and I realized that that's kind of on the forms to cover the medical community's butt legally, but it was still kind of funny. And she was a little bit put off by that, but, you know, I don't have a risk of pregnancy. I was deemed a gold star lesbian. I've never had sexual relations with a member of the opposite sex. And beyond that, last fall when I got my physical and I was going through like risk of STDs, which, because I'm a lesbian, I'm in the lowest risk category for STDs, explaining to my doctor that I had been with a transgendered woman, a woman who had been born a boy but is a woman. She was well into her transition. That was a little bit awkward because I don't think my doctor knew what transgendered was. But once I explained it to her, the doctor was just like, yeah, oh, that's nice. Whatever. She's like, I'm open to diversity. She flat out said that she was open to diversity, and, you know, as long as two people are happy together, that's all that matters. Then, at one point in my life, I was dating a girl and actually got engaged to a girl who had a lot of medical problems. And that was kind of awkward, because here in Ohio, we don't have marriage rights, and we were both very nervous that the doctor would see me just as a friend, rather than as her potential future partner, or potential future wife, even though we never got that far in a relationship. At one point she had to be in the hospital for a number of days, and thankfully enough the staff was very welcoming and very understanding, so that they allowed me to go up and visit her before work, after work, and any time in between. I was not restricted to visiting hours, which I think a lot of hospitals are getting better about that, but that's definitely one thing that I think people in the medical community need to understand, is that partner visitation is important. Another awkward moment was when my girlfriend at the time was having a reaction to medication, and basically something bad had happened, and the nurse kept on referring to me as my girlfriend's mother, which was very awkward, and was just like, no, I'm not her mother, I'm her girlfriend. So I guess from that I would take never assume, which I realize that when you're rushing to get proper treatment for a patient, that can happen, but it's always better to ask than to assume. Like the old saying goes, assuming makes an ass out of you and me. So, going on to my old friend's second question, are you able to be open and honest with your healthcare provider about your sexuality? Well, for me personally, I feel it's very important. Because I don't have the same experiences as a heterosexual woman of my age. Like I said, I've never been with a member of the opposite sex. So, beyond just my woman's health, other parts of my health would be affected by that. Because I'm at low risk of STDs and at no risk of pregnancy, my experiences as a woman are definitely different, even with being only 26 years old. So I do feel it's very important to be open with my sexual orientation to my healthcare provider. Have you ever been treated unfairly by a healthcare provider based on your sexuality? No. I don't think I've ever been treated unfairly. I've been treated just like any other patient or any other patient's partner has been treated. Aside from those couple of awkward moments that I mentioned, I've been lucky enough that I've never been treated unfairly, though there are quite a few people who I know who have, and especially for transgendered individuals. I know a lot of transgendered individuals who are very nervous about going to doctors because, yeah, they were born one way, but they are actually another way, and they're in their transition process, or they do have a medical history of being the opposite sex. But they are their proper gender, especially those who are transitioning or those who have transitioned. Which, as a medical provider, I would highly, highly, highly suggest looking into that and understanding. There are lots of wonderful resources, and at universities, I'm sure that depending on what university you're going to, I'm sure that there's an LGBT, lesbian, gay, bisexual, transgendered resource center where you can get more information about that, and I highly suggest all of you take a look into that. Any other thoughts, feelings you have on marriage, parenting, etc.? Basically, treat us as equals. You know, that's it. I'm a consenting adult. My future wife is going to be a consenting adult. The marriage that we would have would be just as equal to a heterosexual marriage, to an opposite-sex couple's marriage. Only, we can't accidentally have a kid. That's what it boils down to. We can't accidentally have a child. That's the only difference. We still love each other. We still care about each other. We're still there for each other. Just like a heterosexual couple would be. Parenting, well, read the medical research. The American Psychological Association, the American Psychiatric Association all agree that same-sex couples raise kids just as healthy as opposite-sex couples. And there's even some research that suggests lesbians might even be better parents than heterosexual couples, just because it's a social norm for us to really, really, really push education. And in general, that kids living in a same-sex parent's household would be more open to diversity just because they're exposed to more diversity growing up. Overall, this is a really tricky topic, but what it boils down to is treat lesbian, gay, bisexual, transgendered patients or the patient's partner just as you would treat anybody else, just as you would treat any other patient or any other patient's partner. And you will be able to have a healthy relationship with your patient and your patient's partner and all those involved in the wellness of that person who you're trying to make well. I realize that this is a tricky topic, but for my normal YouTube subscribers, feel free to send me any questions, feel free to leave me any comments, and to those in my friend's class, again, feel free to send me any questions, send me any comments. My friend will give you my contact information, and yeah, peace out, and I certainly hope that this is able to help you all. Bye.